Now, here on Breakfast, we recently brought you the story of a pledge by NHS England to stop the overuse of treatments known as antipsychotics.
Every day they're given to thousands of patients in England who are living with learning disabilities or autism in order to control their behaviour.
One such patient was 18-year-old Oliver McGowan, who, as well as being mildly autistic, was also epileptic.
In October 2016, Oliver was admitted to hospital following a seizure and given an antipsychotic drug against the wishes of his parents.
Oliver suffered severe swelling to the brain and died in intensive care the following month.
Now, on Friday, a coroner ruled that doctors had properly prescribed the treatment in Oliver's best interest.
The hospital involved has said it will improve its training for staff treating patients with autism. Oliver's parents, Paula and Tom, are continuing to raise awareness of these antipsychotic treatments, and they've been talking to Charlie and Naga about their story.
Oliver was just a true inspiration to everybody that met him. He seemed to light up a room. There's something about Oliver where everybody was drawn to him. His ability to have a can-do attitude, nothing stopped him. His additional needs, his difficulties were very much secondary to the person that he was.
I mean, Oliver had mild autism, mild learning disabilities through meningitis as a baby, but they never held him back. And one thing he taught me was to always look for the good in every situation. He really worked hard to be the best he could be, and he never asked why me, why did this happen to me? He's very positive, and that's what we'd like to try and carry forward, really, with this situation. He played football at a high level for cerebral palsy and development squads. He was also a T35 registered athlete and trained with Bath to one day harbour an ambition of being a Paralympian. So he always tried to look for the good and drive to be the best every time. So he's a really positive person, and that's what we'd like to try and take forward, really, with this awful situation, really.
Well, it's lovely hearing you, painting that picture. It helps people understand who he was. You have been through, as a family, been through a terrible ordeal. As you say, Tom, you're very much interested now in what lessons can be learned. What do you think those lessons are?
For me, first and foremost, the most important lesson is to actually listen first and foremost to the patient, to the person, and then to listen to the family around the patient, the family and carers. Listening is effective communication. It's actually listening and taking on board what that person is actually saying.
You've been part of the STOMP campaign, which is taking a look at the overuse of psychotropic medicine to manage people's behaviour. What do you want learned?
From my perspective, it seems the default position by doctors and the NHS at the moment is to go down the pharmacological approach, basically to use a medication. Where, as Paula was saying, listening to the patients and the people that know the patients best, we'd engaged with the processes within the NHS, like hospital passports and medical care plans. These were all in place. And yet, when Oliver went into A&E, there were no what's termed the reasonable adjustments, which basically means adapting the environment, giving him a quieter space, not so rowdy. It was a Saturday night in A&E. There was lots going on. He was autistic. He had people on him, people holding him. That was effectively exacerbating the situation. And basically, to cut it short, it would be using other systems rather than medications, especially when individuals have been highlighted as having an intolerance to a particular medication. Now, what happened to Oliver was a rare reaction, and it is a rare reaction. However, we'd highlighted he had intolerances to these drugs, and that should have really signposted to highlight not to use other approaches, and they didn't get used.
Paula, often when families have been through things and they go very public, as you have, to send out a message, a lot of people get in touch telling them similar stories. Have you had a lot of reaction?
Absolutely. I'm quite shocked to actually find... I thought I was alone when this happened to Oliver. I was so shocked that it could happen to Oliver, and I was advised to go public with public media, and the amount of people, Oliver's far from alone. There's so many people who are experiencing the same thing through medications, who, that fortunately they've not lost their children, but it's happening, and it's huge. It's huge.
Paula, can I just ask finally that often people look for some way of settling what are impossible issues to deal with the loss of a son. Is this campaigning for you now very much part of your coping mechanism?
Oh, absolutely. As we said before, Oliver was the most generous, positive person ever. He would want us to do this. He would want us to make changes, but not just changes, effective changes. I've already been approached by actually different people behind the scenes, inviting me to go into A&Es, to talk to doctors, to give educational talks around about what happened to Oliver. So things are already happening, and I'm absolutely pleased about that.
Hopefully, by engaging with campaigns and people who are willing to change, that will help move this forward.
Tom, Paula, thank you very much.
Thank
You're
you.
more than welcome.